This is Waves, a podcast from APTA Michigan. I'm Andy Wicks. To provide the best care, clinicians often have to tailor their delivery to meet the patient where they're at. We change how we provide education, how we occupy space near our patients, how we banter back and forth. It's not so different from how our interactions change based on the context outside of work. We act differently at the store versus the gym versus at work versus at home. But when you are part of an often marginalized group, you may be tempted to change yourself for fear of being a negative factor in a patient encounter. You may have wanted to hide something about yourself just to keep things moving forward. Dr. Allyson Sutkowi-Hemstreet talked with us about how she learned that she provides the best possible patient care when she is genuine with her patients. I think you're going to like this episode.
Hi, my name is Allyson Sutkowi-Hemstreet. My pronouns are she, her, and I'm a physical therapist. I'm almost finished with the faculty development residency at Duke right now. And my primary clinical practice areas are acute care. So I'm a board certified clinical specialist in cardiovascular and pulmonary PT. And I mostly see patients on the cardiothoracic step-down unit for my clinical practice.
So
But I love teaching.
You're one of the smart PTs who does all the cardiothoracic and cardiopulmonary stuff.
It sounds fancy, but
no, it's very impressive. It's very impressive. And Catherine, again, Allyson and I know each other through Twitter. And actually, Allyson, I don't know if you remember, but we did see each other at CSM, but we didn't get a chance to say hi to each other.
We did.
Yeah.
I waved. I was like, I think that's Andy, but I feel awkward about saying hi to an internet friend. But I should have. I won't.
We did the kind of like, the hey, what's up from across the room kind of a thing. I think we're both pretty visually recognizable. So there we go. By the way, thank you for putting the phonetic pronunciation of your last name because I completely butchered that. But I'm guessing you probably get that sometimes.
I do.
And one of the reasons, and we can talk, like I said, Allyson, we can talk about whatever you want. But one of the reasons I wanted to talk with you is because of a recent, I guess it's an op-ed that you wrote, we'll call it that, in the APTA magazine, in the Viewpoints section from June 2023, titled Being Authentic Offers Better Patient Care. What led you to write that, if you don't mind me asking?
Yeah. So I think that the sort of impetus behind some of those reflections, like one, like I have a lot of interactions with students and, I think as our profession in fits and starts moves towards trying to be a little more deliberately inclusive of all types of students, those students are in the classroom and it's really important to me that I am open with them about my identities and how they show up in the clinic and how they impact my patient care. Because when I was a student and when I was a new clinician, I didn't feel like I had very many people any people to talk to about that.
Yeah.
And it was challenging for me. So I'm a second career PT. So I was already kind of fully formed. I was almost 30. So it wasn't like acutely harmful to me, but my experience would have been better. And I think, my clinical educators didn't know how to help me navigate some of those waters when patients were misgendering me or, it was an issue in the clinic and I felt like they were just totally blindsided by it. So yeah, it came from a few places, but I think like big picture, we know that it's good for people's mental health to be able to show up as they are in the clinic and feel like they can be really fully present with their patients. And I think when I was a new clinician, I was worried that my appearance, my androgyny, my orientation was going to be a barrier to patient care. I was worried it was going to get in the way of like really forming that therapeutic alliance with my patients. And I was worried it was going to shift the focus to me and off of them. And I just hated the thought of that. And I didn't always think about it as like my identities as a place of authenticity and a place of potentially being a positive. And I think it is. And that surprised me as I sort of grew into that.
Yeah, you wrote about that in the article specifically, and we'll have a link to it in the show notes. if you haven't seen it, you really should take a quick read at it. It doesn't take long, and I think it's very eye-opening and refreshing is kind of the takeaway that I got from it. Because and I wanted to talk about that fear of that barrier a little bit because I'm in academia also, and one of the things that I talk about with my students is being able to kind of change your delivery. I don't want to use I don't want to talk about changing your personality, but changing your delivery with your patients to kind of meet their needs. But on the flip side, what you made me think about was I hope I'm not giving them the message of they can't be themselves. I don't want that to be the message. I want it to be changing your delivery while still being true to yourself. Can you talk about that a little bit? How you threaded that needle?
Yeah. So, and I think that that is something that is challenging for students. And I think it takes just getting out in the clinic to really feel that out for each individual person. And there's so many identities that I don't have any experience with, in terms of navigating clinical environments as a person of color or someone who doesn't speak English as their first language. There's lots and lots of complexities there that are not mine. So I can't speak to those. But I do think that we use different approaches and we tailor our communication styles and maybe we even tailor our physical presentation, right? Like if you're a big guy, if you know that you are interacting with someone who has had trauma by someone else who's like much bigger than them or something like that, you're probably going to tailor your physical presence, right? Maybe you're going to sit down, or maybe you're going to stand, give them a little more space than you might normally. And that's patient centered. That's not being not authentic to you. That is really trying to center what that person needs in order to be successful in your interaction with them. So, and I feel like that's how I kind of play it, right? If somebody doesn't trust me and I'm in the ICU and they're like, you're little, you're not going to be able to get me out of this bed. I'm going to stand tall. I'm going to show them that I'm confident in my skill set. But, if somebody is really worried and they need to just talk about their feelings for a little bit, if they need to feel safe to tell me that they're scared, cool. I'm going to sit with them. I'm going to pat their hand, right? Like I'm going to be okay to be vulnerable and soft with them too. I don't know. I guess I didn't have a good sense of like when I was younger of like, wow, like that's a powerful tool to really be able to be responsive to someone's needs in that moment. And I don't know, I just didn't think of like androgyny or queerness as this positive in clinical care. And I feel like because I am less restricted by people's gendered expectations, they're like, I don't know what to do with you anyways. Like then I can just kind of be myself and I can be reactive and I can be flexible. And I don't feel as squirrely about that. Right. If I'm really soft with somebody, nobody questions my masculinity. Right. Cause I'm already in this sort of liminal phase all the time.
That's a I mean, that's a wonderful way to look at it, and but you're right in that I think for people who would be more typically put in one category, it can be hard for them to be perceived opposite. Whether you are a petite little thing showing that you are physically capable, or if you're this, incredibly masculine, whatever that is, to be able to show that you can recognize someone else's emotions and respond to that. I think it's your superpower. It's amazing. Love it.
And that it doesn't undercut how you're perceived.
Yeah.
I think that, but I almost wish more people had to wrestle with that because it really like makes you reflect of like, oh, like why do I affect the way I do when I'm encountering these different situations in the clinic? And am I really bound by some of the constraints that I think I am? Or am I like just trying to stay within this little box that people want me to stay in?
Yeah. And I think recognizing I mean, we've all seen this as clinicians. We've all seen this with our patients, but when you've already said it, Allison, when you essentially make it patient centered, you meet their needs, whatever those needs are, then you see that look in their eyes, they see them kind of light up, you see whatever happens, and the results are spectacular. And it's not about you in the first place. It's really it's yeah, it's just it's funny how
Right.
to me how we have all these terms and these discussions and everything, but really what it boils down to is just let's just be patient centered and things seem to work themselves out. I don't know.
Right. And like listen to your patient.
Yeah.
I don't, if they want to talk about football with me or whatever, like, all right,
Yeah.
cool. If that's going to make you more motivated to get your hiney out of bed and do what I'm asking you to, fine. Talk
Exactly.
about, we'll go with it. But yeah, I think I just appreciate like feeling that those things are all sort of accessible to me. And I sometimes just want to share that with students who are rightfully nervous about how their identities are going to impact how they navigate their relationships with coworkers, with patients, with families. And I just want to like put a little bug in their ear of saying, like, I appreciate that this is probably something that can be really stressful and it can absolutely be really harmful. The chances are that by the time the students are showing up in our classrooms, they have already been through lots of harmful and traumatic circumstances.
Yeah.
And I never want to like undervalue that, but I do want them to just consider that their lived experience matters. It can be a positive thing. They have some authority to use it in a positive way and really connect with patients or really connect with communities that matter to them. And that is huge for our profession.
Catherine, I've been kind of dominating. Go ahead.
Okay, let me see if I can summarize. You were asking basically, like, as someone who is feminine presenting and like identifies as a woman, you've had your own sort of negative interactions with patients. And then
Yeah.
the last app I didn't hear.
I think sometimes people who present more masculinely are
Oh, yeah.
for authority than people who present more femininely. And I I guess I wonder if you have any thoughts on that.
Oh, yeah. I mean, I think that gender bias shows up in the clinic, in the hospital. I think it shows up in the classroom. Absolutely. I have zero question about that. And then, like it's been interesting because I haven't always had short hair like my whole life. Like I've
Yeah.
been through lots of different like hairstyles, things like that. And there's literally like a length that's like right here where people treat me different.
That's
Um,
interesting.
Like
it's
threshold.
bonkers, yeah. And yeah, I have so many thoughts about this. We'll keep it brief.
We got all the time in
Um,
the world. We're not regulated by anyone.
Yeah, hopefully we
so
don't have any more technical difficulties.
right. So, like I've had lots of, experiences in the clinic where like I'll have a student with me or I'll have like another PT who I'm training. And like I'll be very upfront with the patients and the families to say, like, here's the situation. Like this person this is where they're at in school. This is like the level experience. And they'll still direct their questions to the dude. Like, okay, hey, let's train it in here. Like this person they literally haven't taken any PT classes yet. Like you can ask me. So that always blows my mind. I think it is also in some of the like higher pressure environments, like if you're doing ICU rounds and things like that, where you're having to talk to like people who are high up the chain or, people with a lot of authority in hospital systems. Like you got to be really quick, really direct, no mincing and beating around the bush like that. And okay, fine. But like, I think some people would perceive that as more of a masculine communication style. Like they don't want to talk about how the patient is feeling or doing emotionally unless it's really, really germane to the clinical piece. Oh, I had one more. Oh, yeah. So also being pregnant was a
Yeah.
really
You talked about that. I
interesting.
was gonna hope I hope we were gonna get there.
Yeah. So I carried both of the children in my family and yeah, I just had a lot of really interesting experiences because I worked at the same clinical place that the whole time. So I had this big subset of people that knew me for a couple of years before I was pregnant. And then it was like I got to a certain point in my pregnancy where people like I was visibly pregnant. People were, like word got around and it like I got a free pass into the girls club. Like people who have never talked to me in the whole previous 3 years were like way more approachable, and like
That's
in a
so
positive way. But it was strange where I just had this like it like just was very obvious to me that something about like that piece of like how powerful that piece is in our culture of femininity and like womanhood
Hmm.
was really powerful. Like it trumped my haircut. It trumped that I'm married to a woman. It trumped everything. They were like, okay, you're like a regular girl now. Like we can just talk about all the things of like, okay, fine with that.
pregnancy equals common ground.
It really does. And that was really interesting because the patients treated me different too. Like a lot of people didn't want me to like give them the appropriate amount of physical assist. They'd be like, oh, like, your condition, like, don't, like, okay,
You
I'm
can't
good.
transfer me now.
Yeah.
Oh, boy.
Yeah. So that was very strange for me to have people do the like little woman thing. So yeah, I feel like I have had a whole like broad gamut of experiences. But so sort of like back to your question is like, I think that happens all the time in our profession. And I don't know the best target audience for ameliorating that,
Yeah.
right? Is it how we talk to all the students? Is it how we talk to clinicians and see, like, is this about training people? Is this about, just bringing awareness to it? I don't know. I'm curious to hear any of your thoughts if you have them.
I well, I guess my sort of privilege is that amongst coworkers and, bosses and et cetera, I've had relatively lower amounts of negative things. Um, but with the general population, I just think there's no way that you're ever gonna make those kind of biases go away completely. So I would have enjoyed, and I know that lots of people, I've will be 7 years into practicing in the fall, but a lot of my peers, I think, would have appreciated better tools of being able to navigate whether it's someone saying something inappropriate about you or just about gender or race, etc.
Mhm.
It's really hard to know how to navigate the line of like, I'm here to serve you, but also you're saying something that's either offensive to me or a coworker or another patient. And how do you create those boundaries?
Absolutely. I think that is a huge skill set. I think I have tried and I have witnessed other educators try to help students build those skills. And that's really interesting because I feel like oftentimes the students don't perceive it as being as important as some of the other content they get. I don't know. I'm curious to hear your thoughts on that, Andy, but I have a hard time
Yeah.
um, with always students understanding that like this is stuff that really deeply impacts your experience at work and your ability to set healthy boundaries and maintain a relationship with patients. It's like they don't quite have the lens to see how important those conversations are and how important those skill sets are.
Very much. And I will, so full caveat, I teach at the school that Catherine was a student in. I was not there when she was a student, but so
That's not true. You were like on a panel for one of the
oh,
courses.
that okay. All right. That's true. I was.
You made an
Um,
impression, a distinct appearance. Like
she didn't say a good impression, just distinct. There's a clear difference.
Remember you?
Oh yeah. Oh, you were that guy. Oh yeah. No, so I'm very acutely aware of those skills, and that's something that I'm very passionate about trying to educate with our students. I
Mhm.
do co-teach a class on essentially communication skills for PTs, looking at the lens of anything from patient interaction to like peer-to-peer interactions to professional presentations, anything, whole
Mm.
gamut. And we're trying really hard to add those elements into it. Now, that's one class out of their 3 years, so it's not enough, and it's something that I really want to try to kind of bake in from the beginning. But what I was gonna say, and I think that Allison, I think you're probably doing it more already, is just the representation and modeling of the behavior that your students see that all the time. And if they see faculty, if they see their mentors, if they see these people acting in a way, they will hopefully emulate that for good or bad. So, that's another thing that I'm really passionate about is like student mental health and well-being.
Mhm.
And and I'm even going to tie this back to a comment you made way at the beginning about kind of being, I forget the term that you use, but essentially kind of being honest and maybe vulnerable with your students about your own experience. And I've done this with my
Mhm.
students, and I've had students then come up to me afterwards and say like, "No, I've never had a PT talk about their battles with depression and anxiety before." Because I'm
Yeah.
pretty open and honest. I've been dealing with that for years. But like the fact that no one's ever talked to them about it, they've never known how people deal with that in the clinic and things like that. So, just, I wish that for my own sake, for my own mental health, that I had that kind of model similar to how you, I think, wish you had models of your own to show you those things. Truth is they just, they weren't there, but, or at least they weren't there in the number and degree to which maybe we would have liked. But we're, I think, working to change that in our own little ways. So,
Mhm. Yeah. And that's like our spheres of influence, right? It's hard to change an entire profession. It's hard to change an entire culture, but you show up where you are and you do the best you can. I think one thing that is particularly challenging is like the intersectional piece, and that I think matters a lot. That's why diversifying faculty and clinical educators is so important because, you know, if we are going to actively recruit individuals into this profession and often bring them into predominantly white institutions, we're really trying to say like we want all these different types of people to be here. Are we really equipped to help support them along the way?
yeah,
And
we want you to be here,
that's
but
our
once you're here, you're kind of on your own.
well, so that gets back to that issue of like, well, why do you want those students in your program? Are you hoping to check a box with it, or do you really perceive how much value they add to your program, to the profession, to the perspectives and understanding and cultural humility of the other people in your program?
Yeah.
And that I think is very highly variable.
Yes.
And I think another piece of that is that like different people are able to be sort of out about whatever their thing is, right? Like I have a lot of privilege because like I'm white, I speak English, I'm not disabled, I'm not divergent, like I have a lot of privilege. And if this is the one thing that like makes me stand out and makes me feel different and, sort of calls into how much I feel like I belong in certain environments, well, okay, like I feel like I feel like it's kind of my job to show up like that.
Yeah.
Um, and that's just me. I don't project that onto anyone else. For me, I feel like this is my thing. This is part of why I came back to do the faculty residency because I really strongly believe that like lots of different people deserve to be in those spaces and that we are better when we have many different lenses looking at the same issues.
Yeah. I think this is a bit of a sidebar, but I'm curious to hear both of your takes on this. Something that you said, Allison, about that kind of extra job that you've taken on. But I think that element of representation in this career, in this role as a PT. I mean, I'm a white heterosexual male. I am the majority. So it's a little weird for me to talk about this. I recognize that. But there's other things obviously about me that are unique and different and blah blah blah. But I think that one thing that wasn't one thing I didn't key in on when I was a student is kind of the how much of me and my personality and my, you know, whatever it is that makes up me would bleed into what I do as a PT. And and I don't that wasn't really, that wasn't talked about as when I was a student, and wasn't until I started working that I was like, wow, this is a hugely emotionally push and pull kind of a career here. And and I don't know how we talk about that, if we talk about that, should we talk about that with students? I mean, they're already so burdened with just trying to get through the next test and, this and that and the other, but then do we set them up for failure when they're out in the clinic, out actually being PTs, and all of a sudden then, Catherine, you've talked about it, just like all of a sudden realizing the emotional weight that they carry that maybe we should have done a better job talking about when they were in school.
I'll
Go
let
ahead,
you
discuss.
you go first, Allison. I have my own thoughts, but
Yeah, I mean, I think we have to talk about that. I Because you could have 10 different PTs treating the same patient and they would all do it a little different. And that doesn't mean it's wrong. It doesn't, I know there are discussions around sort of standardization of care and practices. And I think there's absolutely a place for that. But we're never going to standardize communication. We're never going to standardize relationships. And PT is inherently dependent on that therapeutic alliance. And you have to negotiate that from your own place. So, and I think that's where like education about DEI and communication and also humanities can really be beneficial, right? Because I think that is so powerful to intentionally introduce students to concepts like ambiguity, right? Say,
Oh,
okay,
that's like a
oh,
swear word.
I know. They get so mad. They get so mad, but I at least want them to have like one example, one time where we really wrestled with it. Like we really said, like, this is messed up. You are never going to feel like you made 100% the right choice.
Yeah.
And how do you sit with that? How do you sit with that clinically? How do you sit with that emotionally? Because it's not straightforward.
And it's going to be that
And
way.
I think it is worthwhile trying to negate that expectation that you are ever going to get an absolute right answer. Sometimes,
Love it.
I feel a sigh of relief just hearing you say.
yeah, because like, what's the next step of that if you have never felt like, okay, it's okay for things to be ambiguous. It's okay for me to feel like, man, I didn't do that right. I feel ashamed about that. Well, what are you going to do with it? What do
Yeah.
you do with all those squishy, horrible feelings where you're like, I wasn't prepared for that?
Those icky, icky feelings.
Yeah, because you're going to have them.
Mhm.
Mhm.
And that's part of mental well-being, right? Is being able to say like, man, that sucked. Whatever happened there, that sucked. What am I going to do about it? How am I going to move forward? How am I going to progress myself? Do I believe that that was a product? Do I believe that that situation was, can I parse it out? Was this a
Yeah.
knowledge issue? Was this a communication issue? Was this expectations? I don't know. What was the crux of it? Is this an ethical quandary? Because you're going to have those too. I have a ton of them. I worked through COVID in the hospital. Like I have unresolved feelings. Yes.
Oh, man.
So do we name it? Do we go after it with people who have sort of low context for what we're talking about?
Well, yeah, and I'll say, I mean, yeah, I love our students that I have. I absolutely love what they're doing, and I'm proud of them for what they're doing. But some of them just and it's no fault of their own, but they lack life experience, and they lack situations where they've had to wrestle with that. And oftentimes, it's not until they're in our classrooms and we, you know, yes, that's when sometimes when they first encounter, or when they're on their clinical rotation and suddenly they're set up with a situation that they can't. There's not a clear answer. And I've had students come back to me with stuff like that when I do tell them it depends, because they hate it when I say it, because I also have a little bit of a devilish grin when I say it. But for them to say things like, the NPTE is not an ambiguous test. Like I recognize that dichotomy. I recognize that, it is yes and, and And once again, and then it's ambiguous, and that's just completely unsatisfying to them. But I'm like, sorry.
And it's like, well, okay, it depends, but what does it depend on?
Mhm.
Tell me that. Let's talk. Let's try to
Yes.
break it down a little bit because, like, that's what they're struggling with. Like, it's like they can sometimes tolerate some ambiguity as long as they have a structure for
Yeah.
trying to, deconstruct everything
Well,
that is
that's
in their
what
brain.
yeah, and that's the best part is that why does it depend? What's the why? Why? If you can figure that out, you're gonna be fine. You're gonna be
Yeah.
fine. And that's that next level thinking that, that's where the challenge lies. And I recognize that and I understand that. And the students don't want to get there because they're still trying to get to the what, not the why. But we've all been there. We were all students once. We remember.
And do we dose that appropriately for them? Do we intentionally introduce it across the curriculum in an intentional way? Oh, you just got to hear here. Let me give you just a little taste of it, right? We like inoculate them with some of those, right? And that's to your point about you don't like it that it's stuck in one class because it is something that is probably best served by it being scaffolded across a didactic part of the curriculum.
We talked with Nicole Piemonte, Dr. Nicole Piemonte. Do you know who she is? She's a wonderful human being. I recommend that you get to know her. She spoke at ELC 2021, I want to say a couple years ago. But
Okay.
anyway, she has a PhD in medical humanities, I want to say.
Oh,
I know. It's
love.
super awesome, super awesome. And we interviewed her a couple years ago and talked with her, and she is on faculty at the Creighton Med School in Phoenix, and how they kind of are baking the humanities aspect of it all throughout the didactic portion, just like you said, which is really the best way to do it. So it's not a module, it's not a named thing. It's a part of everything that they do. And that's man, that's like my dream. When we get there, okay, we're gonna do it.
Okay. We can talk offline, but I have a cool thing that we
Okay,
we
cool.
talk.
Well, and I've already
Uh,
talked. I was actually going to say, Allison, you have now made Duke University the highest represented school of physical therapy on this podcast because we talked to Dr. Covington a couple years ago as well,
oh, okay.
and
Awesome.
we talked about some things like that. So, but yes, I
Okay.
mean it's like I want to do that. I want to do that somehow. So,
Catherine, you seem like you have something.
Yeah, I have a couple
sorry.
thoughts. So my one point or one comment is, do you feel like this low tolerance for ambiguity is a new thing or has that always been present? Because sometimes I implicate the fact that, I'm of the generation that grew up with the introduction of standardized testing from early elementary on. So literally like your entire
Mm,
like how you're educated to perceive the world is in this black and white framework where you're tied to numbers and benchmarks, etc. And I think a I I guess I just want to defend the student perspective of it's kind of pulling up the rug from underneath you when all of a sudden you've been trained your entire academic career to be expected to come to one right answer, and
Absolutely.
all of a sudden that's not what's expected anymore. Personally, as a student, I welcomed that, but I can see how that's frustrating.
yeah.
Um, and then also, just once you become a practicing clinician, there are other forces that tell you it's wrong to see things with ambiguity. The forms that you have to fill out for insurance, your employer expecting certain productivity standards, everything being drilled down to the 8-minute rule of what you did in terms of units. So it's really challenging to both be participating in this very like black and white cut and dry universe that our healthcare system has become that doesn't really reflect what caring for people actually looks like.
Yes. Yeah, absolutely. I think it's both and, right? Because and those are the structures that we do operate under. And, as educators, we have our own finite constraints. Like,
Yeah.
okay, yeah, like this isn't how I'd like to assess you on it, but there's 100 students in the cohort at Duke. I
Yeah.
can't do,
Yeah. How do you do it? Yes.
Yeah.
yeah, I literally can't do certain types of assessments, or I will not be able to function in the rest of my job. So,
DPT school would take like 5 years.
yeah, I mean,
And no
well,
one
you got
wants
time for that.
No one wants that.
Yeah. But yeah, I think, I don't know. I think sometimes the best antidote I can think of is to just name that,
Yeah.
right? Just
Mhm.
to identify that. Look, like there are some things where you do have to pass this test. We're not even talking about it, the test, equitable for everyone. That's a totally separate
That's a
topic.
different episode.
Totally different episode. But right, like yes, you're required to have these baseline knowledge, and you're gonna pass your test and you get your license, and you're gonna go out into this very ambiguous world that just is. And I can't make it easier for you. I can help you develop your internal self, and I can help you develop some tools, and
Yeah.
I can give you my perspectives, and I can tell you about things that caused me strife as a clinician. But it's not perfect.
We just try
And
to
I don't
learn.
have, yeah, I don't have a better answer than that.
Well, I think just being able to rest with the idea that it isn't perfect and it's never going to be perfect and we're never like, yeah, the inner perfectionist comes out.
Yeah. Yep. And that's huge, and I think especially it's not, I think sometimes we like chuckle about it, but like mm, it's really important that the students understand that they cannot be perfect. They will not be perfect. They will not get 100% on everything. And it doesn't mean that they aren't smart. It doesn't mean that they're not going to be a great PT. It doesn't mean that they don't belong there. And that's okay. They that like all of those things can still be true, and you can still get a 70 on your integument test or whatever. Like, it's okay.
Yeah. Yeah.
You're not gonna slay everything. It's okay. Are you working hard? Do you understand most of it?
Yeah.
Are you putting it together? Are you invested in your own capability of addressing the areas that you have deficits in? Because it's on you. If you are fine to be a middling clinician, that's fine. And if you're not, you have the skill set to reflect and the skill set to be able to identify what you need to improve. That's like that master adaptive learner
Yeah.
idea.
I've had conversations with my students, especially on practicals. Practicals are, we all remember how stressful practicals were, but
Yeah.
helping my students recognize that, and I've tried to do this, and I haven't figured out a great way to really incorporate it into my rubrics, but for them to recognize, I've told them, like, I don't care if you make a mistake. I care that you recognize that you made a mistake and are taking steps to fix it, because that's where you learn. You're not going to learn if it's just easy and you ace it. Like, that just tells me that you crammed and crammed and crammed. But if you get presented with a situation where suddenly you have a disconnect and something isn't working, for you to be able to step back and say, okay, what's going on here? Let me try something based on this, whatever I'm seeing. Like, that's, to me, I've tried to tell them, like, that's more important to me, that you are recognizing where the problem lies. And then we can get into the finer points of trying to fix it. But
Well, and like I think grading practicals, my preference, if time allows, is always to start with the student's reflections. You must tell me a couple of things that you did well, and then you can talk to me about some things that were challenging for you. And what do you think was really at the crux of those challenges?
was it the
'Cause-
compliment sandwich?
yeah. Well, but they have to give it to themselves, right?
I like that.
And then if there's gaps there, can you ask them some leading questions? Tell me about why you decided to do whatever, right? That's our communication,
Yes. I'm just
right?
reminded
That's
of
where
when I
we
was a student
shine.
and our class president was supposed to palpate the pisiform and instead tried to palpate the piriformis. And I still remember that. He
An important
recognized his mistake,
distinction.
though. He recognized his mistake.
I'm touching your bottom now,
Student,
and
beautiful, will never make that mistake ever again. Allyson, we are very pro.
way off track.
Oh, there was never a track. That's where
Okay.
you're wrong. There was never a track.
Okay, great.
we are very pro soapbox on this podcast.
Okay.
So if you have one or seven that you'd like to get on and speak from, you're more than welcome.
It's very open.
It is very open, intentionally so.
Okay,
Doesn't
can
have
I
to.
ask you one question while I'm reflecting on that?
Yes.
So, as someone who is focused on students' well-being and communication, tell me your feelings about hybrid education.
I recognize, to me, it's hybrid education is a bit like telehealth in a way, in that I can recognize its value if we look at it from a lens of accessibility. And I think being, you know, let's be realistic with the way that today's world is, that doing things in front of a screen like we're doing right now is not difficult to do, and it's certainly, it's not like unusual to ask someone to sit in front of a screen for a while. It's not my preferred method. I think you lose a lot from face-to-face interaction. And short of doing 100% telehealth care, you probably aren't going to be in front of a screen with your patients. You are going to be face-to-face with them. And to be able to recognize and read body language, emotions, gauge the temperature in the room, so to speak. You can't do that very well over a computer, in my opinion. So there, how's that?
Yeah, no, I was just curious, and I'm always interested, to hear different perspectives on it because, like, it's not going anywhere.
Well,
And I,
in full disclosure, like, I'm looking at some grad programs from some terminal degree programs that are fully
Mhm,
online, because
mhm.
that's what I would need to do to be able to do it and still do my job and blah blah blah. Like, I get it. It's not, to me, um taboo or anything like that, but it's just like, it it, it lacks things that for our profession I think are crucial.
I think that's fair. I think there are absolute and specific challenges. Okay, so your question it wasn't really a question, it was do with
It was an
soapbox.
invitation.
Okay, I guess, trying to sort of bring us full circle to, like, some of these ideas of, like, authenticity and humanity and connection and, like, people being able to be themselves and to be whole and to be well in their professional settings and in their professional identities. I guess this is more of a wish. I hope that more people in our profession will consider what is their stake in equity work, because I think that I don't know, I think there's probably some people that feel like it's sort of not their issue and they don't want to be, like, tromping all over it or taking up space, or they don't want to, be talking over other voices. And I appreciate that. And I think that is 100% a reasonable concern to have. And I don't think it lets you off the hook for still offering meaningful time, effort, and, like, contributions.
Mhm.
And I think that's something that has evolved for me, so I've been out since I was 18. I knew I was queer, as a young teenager. And, there's I've had enough challenges in that negotiating that part of my identity, like, all the ways,
Mhm.
different states voting for marriage equality and all sort of trash like that, right? Minus just interpersonal interactions.
Mhm.
But I think because I felt like I lived in these really progressive areas, I had, like, a super diverse friend group, and I already had this, like, sort of cross to bear, that it kind of allowed me to disengage from some of the challenges of other groups that are, like, historically excluded.
Mhm.
And I don't feel like that now. I feel like more like more responsible for other for like other people's problems. That's in quotes, right? Because like humanity. And, I really have just tried to think more about like using my privilege and using my voice in different ways and making meaningful, like impactful contributions, not just like, well, yeah, I'm liberal, I'm on your team, that doesn't count. It doesn't make a difference for people who are like really suffering and like, health equity and like violence and all these like big, serious legislative issues. Like that doesn't help just sort of philosophically being aligned. That's insufficient. So that's, that was a soapbox.
That's a good soapbox. I like it.
My question is what's your stake? What's your stake in some of these issues, even if it's not, quote, your issue?
Well, Allyson, thank you so much for spending some time with us. I hope this was, I mean, it was wonderful for me. I feel like I learned a lot. I feel like we had some great conversations. I took a ton of notes. So I'm excited. I'm excited to get this episode out there.
Great. Thanks for having me.
Of course.
I didn't completely talk your face off.
Oh, no, not
we wanted.
This is why we had you on. Anything you want to promote? Anything like that? I don't know.
Yeah, I mean, like the faculty development residency, I guess. I mean, it's
we didn't talk about that.
Yeah, it's been really impactful for me. There's a ton of fantastic people involved in that program. And I think it's a great opportunity for people who might not have as many, and who where a faculty position might not be as accessible for them. Mm-hmm. It's a great way to, have some opportunities to grow in that area if that's of interest to anyone.
Very cool.
Yeah.
Well, when you see Dr. Covington, tell him hi for us.
I sure will.
And again, thank you so much. We will have all the links to stuff we talked about in the episode as soon as it is published. And Allyson will see you around, all right?
Okay. Thank you so much. Great to meet you.
Dr. Allyson Sutkowi-Hemstreet is a board-certified cardiopulmonary clinical specialist and a core faculty member in the Division of Physical Therapy at the University of Minnesota. She is an embracer of ambiguity and a good person to know. Waves is a production of APTA Michigan. It is co-hosted by Dr. Catherine Klein and me, Andy Wicks. We are on social media at APTAMIWaves or on our website at www.aptami.org/podcasts. Thank you for listening, and may your documentation always be done on time.